When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
This morning, when I saw this article, I made a call to make sure that Santé Québec, with the arrival of Santé Québec, any Quebecers will have the right to get his services at the location that he wants to.
That's Christian Dubé, Quebec's health minister, yesterday speaking about a story about the MUHC, the McGill University Health Center, which announced it would impose restrictions on patients who don't live on the island. Now, the hospital says they're trying to reduce congestion by not accepting off-island patient requests for blood tests and imaging examinations. So let's talk a little bit more about this. Dr. Samer Daher joins us on the line, president of the Association of General Practitioners of Montreal. Dr. Daher, welcome to the program.
Thank you, sir.
What do you make of the changes in policy that the MUHC is doing here?
Actually, those changes are a bit surprising to us because the system is already overloaded. So when you remove one or two big players like the SHUM and the MUHC, I mean, the waiting times elsewhere would be just horrendous. They're going to get even worse than what they are right now. You know, one of the problems is patients, when they need to have their MRI or scan or whatever it is, they send their requisitions to multiple hospitals, and they wait for the first one to call them. So there's a problem there to really know what's the real waiting time. That's an issue. The second issue, let's say a patient of mine, my office is in downtown Montreal. I do treat a lot of patients from outside of Montreal, Laval, Longueuil, whatever. They come and see me, and let's say they need a scan, like the patient, that very sweet lady that was referred and was treated for cancer. She used to live in downtown. She was treated for a cancer at the MUHC 4 years ago. She moved to Laval. Now she has another health issue, and she would like to get service at the MUHC. So let's say I requested the CT scan to be done at the MUHC to have everything at the same place. Mm-hmm. Well, I cannot do it anymore. Is that fair for patients?
Now, you heard the health minister who said, Santé Québec's going to look at this. We're talking to all the managers. We're not going to let this happen. Well, how do you think that plays out? Because I don't think the MUHC has responded, oh, yes, we agree. Who do you think is going to win this battle?
Well, I hope it's not going to be a battle. I hope they're going to sit down and just figure out ways to make the services more accessible to people. And then if they want to reserve those big hospitals for inpatients or patients treated already at these sites, well, let it be. But for now, services are extremely hard to get. Us as doctors, we try to sit down and call, and it doesn't end. Uh-huh. So before finding solutions, they cannot just limit or put those limits on patients.
Dr. Daher, when I spoke about this yesterday on the program, and I took some phone calls from listeners and got text messages from listeners, some listeners wrote to me and said, listen, I'm being followed by an MUHC doctor. I'm getting treated at the MUHC, and my test results and my exams, they're taking too long. They were in favor of this because they're like, hey, I'm already at the MUHC and everything is taking too long. Maybe people from off island shouldn't be going there. What do you say to something like that?
That's a very tricky question. Of course, I do understand them. But then again, I have to understand those who do not have access also. So the issue is, why don't they optimize at first the services? Why don't they try and run their machines, their scans, their MRIs, 18 to 20 hours a day like other hospitals do? I don't know whether they do this or not. Mm-hmm. But let them optimize and let us see how things can be figured out. But I think if everyone sits down at the same time through Santé Québec or the Ministry of Health right now, they can find solutions. They can reduce those waiting lists. They can make the system a bit more efficient so that and then we can say, let's reserve this for that kind of treatment and this hospital for that other kind of treatment. But right now, the way things are, I'm not in favor of that for now.
We're with Dr. Samer Daher, president of the Association of General Practitioners of Montreal. We're talking about recent policy changes made by the MUHC on testing and diagnostic images that the health minister and many others have an issue with. So, Dr. Daher, I heard from a listener who told me, and the MUHC actually, in their official statement yesterday, they pointed out there are actually new testing centers that have opened up through the CIS and the CIUS sites. I had a listener who wrote to me, hey, there's a new test. You can now go get blood tests at DeCarry Square, for instance. So what about what the MUHC says? Hey, there's other options now that you can book via Click Santé, and you know that they'd like them to go to those options to relieve the pressure on the hospital.
For blood tests, I have no issue with that because, yes, there are opening more sites, but there are some specific tests that you cannot have them done at those specific areas. Let's say the H. pylori, that bacteria that causes the stomach ulcers. This particular test has to be done at a hospital. So let's say I do refer the patient, the Square DeCarry will tell me, well, we're sorry, he has to go to a hospital. There are still some tests that cannot be done in those areas. And we're talking mostly about MRIs and CT scans and ultrasounds. Ultrasounds can be done in private clinics, and they are covered by the Régie d'assurance maladie. CT scans and MRIs, no. And the waiting times are extremely long for those tests. Mm-hmm. If a patient wants to have them done at a clinic, he has to pay, or his insurance pays for that. So the natural choice for people is to go to hospitals. And knowing that there's a lot of waiting time, well, they send it to 2, 3, or 4 hospitals. How about the Minister of Health or Santé Québec sits down and says, let's find a way. Maybe one requisition can be sent to one hospital to prevent that multiplication of requisitions in multiple hospitals and prevent that artificial increasing of the waiting time.
And it's so true. Like, I have sent requisitions to multiple spots, right? Because I'm told that's what you should do, which doesn't seem to make a lot of sense to me. Let me ask you to wrap up here. You know, budgets for healthcare have increased. It seems like governments have never spent more money. The results aren't there, though. We're waiting longer and longer. What do you think, Dr. Daher, at the core is the root cause of these increase in wait times and lack of access to basic things like imaging and testing?
Well, a lot of mistakes have been made through the last 25 years. When they pushed nurses and doctors to retire, and 2 years later they came back to tell them, oh, no, please come back. We need you. We miscalculated. Did they really think about the population getting older? They're getting sicker. They live longer. They have longer life expectancy. So when you have a longer life expectancy, you have more chances of getting problems. And we don't have enough people to treat and to prevent diseases. So right now, the problem is we don't have enough beds in hospitals. When you compare Quebec to the rest of the industrial world, we're way back, and you don't have enough primary care practitioners, whether specialized nurses, whether regular nurses, whether family doctors. We don't have enough of them. So as long as this problem goes on, we're never going to get out of this problem.
Dr. Daher, we have to leave it there. Thanks so much for your time this morning.
Thank you, sir. Have a good day.
That's Dr. Samer Daher, president of the Association of General Practitioners of Montreal.